Dangerous delay. The News4JAX I-TEAM has uncovered thousands of complaints filed over 3 years against a taxpayer-funded transportation company for Medicaid recipients.
Loved ones say their elderly family members have been left stranded while waiting to be taken to or from doctor's appointments. I-TEAM investigator Ann Maxwell found out there has been little oversight of the program.
Some of the stories are frightening. One woman told me her elderly father missed multiple appointments because the company failed to pick him up, at one point leaving him stranded in his wheelchair in the Jacksonville heat for 5 hours. The company, MotiveCare, says it's now looking into that. More than 2,300 complaints have been made to the state of Florida against non-emergency medical transportation company MotiveCare from 2017 to 2021. Some of those are from when the company was known as Logisticare. Until recently, Renee Reynolds depended on MotiveCare to get her 84-year-old father to and from doctor's appointments. She says she never filed a complaint with the state, even though she experienced plenty of problems with the service, including rides that were late or never came at all.
Every time I called MotiveCare, it was another 20 minutes, another 20 minutes. I mean, this went on for 3.5 hours. I was about to pull my hair out.
She says missed or late pickups left her scrambling, wasted doctor's time, and sometimes left her dad and his caretaker stranded outside of providers' offices.
And so they had run out of water, 98-degree heat, 5 hours before somebody finally showed up.
She says she's called the company to complain, but it doesn't go anywhere.
You know, I don't get a case number. I don't ever get a call back to find out whatever happened to it or things they're going to do to change. Nothing. It's just a black hole.
MotiveCare works as a hub that connects patients to transportation providers on the ground. The thousands of complaints made to the Florida Agency for Healthcare Administration, or AHCA, show sometimes MotiveCare was at fault for leaving patients stranded, like when one missed 2 appointments and another arrived 3 hours late to an appointment. The records show those clients were assigned new transportation providers and added to a monitoring list to make sure they got the rides they needed. But sometimes the transportation providers were at fault for no-shows, canceling trips but failing to notify MotiveCare they were no longer coming. The records show those ride services were sent for internal review. Reynolds says several times when the scheduled driver didn't show up, they would pay cash out of desperation to another driver they'd previously used through MotiveCare.
Like the one time that he was stuck outside the dentist's office for 3.5 hours, we managed to contact the fellow who had dropped him off, and we paid him like $60 or $80. It was, it was a pretty, to only go like 10 miles. It was a pretty good fee that we gave him, but we had no recourse.
She says what makes it especially frustrating is she lives in Houston, Texas, while her dad is in Jacksonville.
You feel so helpless. Especially when he's someplace and he can't get home.
State records show AHCA has a contract with MotiveCare worth more than $15 million. It started in 2019 and currently runs through 2023. Records also show a 2014 audit by FDOT of the company, which was known as Logisticare at the time, found the documents reviewed didn't provide sufficient evidence that everything the company was required to do was done satisfactorily. The company hasn't been audited since then, state records show. The I-TEAM asked FDOT and AHCA whether there's been any corrective action since then, but neither responded.
What do you think needs to happen with MotiveCare?
There has to be some oversight.
AHCA did not respond to our request for comment either on the complaints they received or the specifics of Reynolds' case, but the I-TEAM's request to them remains open. In a statement to the I-TEAM, a MotiveCare spokesperson said, quote, MotiveCare's priority is safe and reliable transportation. We understand that health plan members rely on our team to provide non-emergency medical transportation to access necessary care, and we are committed to meeting that need. They went on to say MotiveCare takes all member experience matters very seriously, and they're looking into the issues Reynolds says she experienced trying to get her dad to his appointments. There are other non-emergency medical transportation providers with contracts for other Medicaid plans in Florida, although MotiveCare serves most of the larger plans. We've requested data to find out if complaints have been made against those other providers. We'll update this story when we hear back. Ann Maxwell, Channel 4, the local station.